for those organs that are female. Once again, welcome to all of you and to our invited speakers. Ms. Varsha Bogle has the honor of introducing our first speaker, Dr. Rochelle Varthraj. Varsha.
Namaste. Thank you, Dr. Ramklas. Before I introduce Dr. Varthraj, I would like to thank the very young and talented Divya Ramklas for putting together the amazing video at the introduction. The video highlighted some of the events and projects that the Arya Samaj Women's Forum have hosted. Thank you, Divya. The video was very professionally executed. Dr. Rochelle Varthraj is a specialist obstetrician and gynecologist based in Netcare Parklands Hospital in Durban. Born and raised in Durban, she practices and serves the community in her area. Dr. Varthraj spent most of her years as a specialist at King Edward Hospital, where she also lectured to medical students. She has her master's in obstetrics and gynecology, and her research study based on ovarian surgery won first prize in the Cape Town Gynecology Conference. She holds certificates in aesthetic gynecology and was the first gynecological registrar to present in local Durban societies on research papers. Dr. Varthraj has also published articles in international obstetric journals. She is married with 2 daughters, and this motivates her interest in female health and well-being. Dr. Varthraj, please share your screen. Participants, please write questions to Dr. Varthraj in the chat box. She will respond to these later in the presentation. Dr. Varthraj, over to you.
Thank you so much for that introduction. Good afternoon, ladies. Thank you so much for having me over today. I've prepared 4 topics for discussion, so I'm going to get right down to it, so we'll have enough time for the Q&A session. Okay, so let me just share the screen. So HPV, what is it? Human papillomavirus is a sexually transmitted virus. There are more than 100 different strains. It's so common that 3 out of 4 adults present with the disease. In most cases, people who are infected do not even present with symptoms. It's a sexually transmitted virus that can be transmitted orally via male or female genitalia or skin-to-skin contact. It commonly presents as warts on the palms of the hands or soles of the feet. In the genitalia, it is seen as skin warts or as cervical cancer. HPV can be passed even when an infected person has no signs or symptoms. Anyone who's sexually active can get it. You can also develop symptoms years after sexual intercourse with an infected person. So this makes it very hard to know when you first became infected. So we know that genital HPV infection is commonly seen in sexually active people. A study that was conducted in 2018 found that there were 43 million active HPV infections. The most common group with new infections was seen between the ages of 15 to 24, as highlighted in this graph, which shows an alarming increase of new infections at such an early age. So does it cause health problems? In most cases, HPV goes away in 8 to 13 months. For those strains that persist, it can cause health issues like cancer of the cervix and penis, as well as genital warts. Warts can be small or large, raised or flat, small in number or profuse. So how do we check for HPV? All sexually active women above the ages of 25 should have pap smears done. Most patients don't even know that they have HPV infection, so therefore screening of the cervix is vital. Pap smears should be done regularly, especially if there are multiple sexual partners. HPV DNA testing can also be used in conjunction with a pap smear for a definite test. So this image just highlights what a pap smear looks like. We insert an instrument called a speculum into the vaginal area, and it allows us visualization of the cervix. A brush is entered into the os and it's brushed 5 times and then introduced into a liquid solution that is sent off to the lab. So whenever we get results from a lab, what we're looking for at these blue cells is HPV infective cells. Now, we're concerned about these cells because if left on their own without any form of treatment, they can become invasive lesion as indicated by this image. So how can I prevent HPV? Abstinence is key. Sexual debut should be delayed unless in a long-term or steady relationship, and a person should always employ proper sexual practice. Always use a condom or avoid skin-to-skin contact. Have one sexual partner to reduce the incidence of sexually transmitted infections and encourage circumcisions with male partners. So just to touch a little bit on the HPV vaccine, we know that they're effective. They can protect against the development of genital cancers. And in South Africa, it's recommended to girls between the ages of 9 to 12. It can also be administered to ladies up to the ages of 45, and the vaccine protects against the common cancer-forming HPV strains. The vaccine is usually given in 3 doses at 0, 2, and 6 months. It's effective against strains 6 and 11, and these cause warts, and strains 16 and 18, which cause cancer. The vaccine is most effective if taken prior to sexual debut, and if the vaccine is administered to ladies that are already active, it may help to prevent the progression of the disease as well as destroying any further infection. In South Africa, we have 2 formulations that is available, Gardasil and Severix. The Gardasil protects against the 4 strains 6, 11, 16, and 18, and Severix protects against 16 and 18. So just looking at this little image given to us, the key thing moving forth is identification of 2 strains, 16 and 18, that is associated with cervical cancer, and 6 and 11 associated with warts. Now, in terms of side effects, the HPV vaccine has a very good safety profile. Patients will present with a bit of pain or swelling, redness, and a little bit of itching around the injection sites, but usually the symptoms are very mild. So what's the special precautions? We haven't really investigated the data enough in pregnant ladies, so we don't recommend pregnant ladies getting the vaccine. If a woman was already vaccinated and becomes pregnant, we will follow through with the final vaccinations post-delivery. So what's our take-home message on HPV? It's sexually transmitted. Most people may have no symptoms. Regular screening with pap smears can help to detect HPV, and abstinence is key in the prevention in young adults. The HPV vaccine is effective. Okay, we're now going to go on to our next topic, which is contraception. So this image just highlights the variety of contraceptive devices that are currently on the market. The key thing is, what is contraception? It's a method that's used to prevent pregnancy. It can be divided into barriers like male and female condoms, hormonal therapy, which uses hormones to prevent ovulation, intrauterine devices that use both hormones and copper to create a hostile environment in the uterus to prevent implantation. So if we have a look at this picture in front of us, the key thing is 3 areas. 1, the ovary. So the contraceptive wants to prevent ovulation. 2, the uterine lining. The contraception wants to prevent implantation of a fertilized embryo. And 3, the vaginal area and cervix. So a contraception's aim is to thicken the mucus so it prevents entry of the sperm into the uterus. Many elements should be considered before choosing a contraceptive. These elements must include safety, effectiveness, and affordability. Contraceptive counseling with your healthcare provider is essential in order to decide which contraceptive method is suitable for you. In choosing a method of contraception, dual protection should be used in prevention of sexually transmitted diseases. Although hormonal contraceptives and intrauterine devices are effective in preventing pregnancy, it does not protect against STDs. So we're just going to discuss what's available on the market at the moment in terms of intrauterine devices. We have hormonal containing and copper containing devices. So the Mirena and the Kylina are the hormonal devices. They are small T-shaped devices that are inserted into the uterus, and they release small amounts of progesterone daily, which helps to prevent pregnancy. These devices can be in the uterus for a period of about 5 years, and its failure rate is less than 1%. The copper T device is a device that is inserted into the uterus for 10 years. Its main action is to create a hostile environment in the uterus to prevent implantation. It does not contain hormones and thus can't help with management of hormonal disturbances. Its failure rate is less than 1%. So just looking at an overview here of intrauterine devices, we know they're super effective. They have to be inserted into the uterus by a medical practitioner. It's either hormones or copper ions that are released that affect the medium inside the uterus. One of the fabulous things about it is that it offers long-term contraception, but one of the negative things is that it does not protect against sexually transmitted infections. The next device in a hormonal front is the implant or implanon. It's a single rod and it's inserted in the upper arm. It releases progesterone and it's there for a period of up to 3 years. The advantages is that the rod gives us 3 years of pregnancy protection. It's reversible. So once that rod comes out, pregnancy is definitely a possibility. Usually the rod is in areas that is not visible, so it makes it very nice to use. The disadvantages is that these hormonal devices can result in irregular bleeding. It does require a little surgical procedure in order to insert, and it causes a little bit of scarring and pain. It does not protect against STIs. The other device that we have on a hormonal front are injections or shots, which is the progesterone. They can be injected into the arm or buttock every 2 to 3 months. It's a very effective form of therapy, and it's given to those ladies that can't take oral therapy. Most notably, this form of contraception may delay fertility as the hormone may remain in the system for up to 18 months. So let's talk about the good things associated to the injection. It decreases bleeding and pain. It's fabulous management for endometriosis, prevention of endometrial cancers and ovarian cancers, and it also decreases our need in terms of pregnancy. The disadvantages is that it can cause irregular bleeding, it results in vaginal dryness, and the worst possible thing, causes weight gain and water retention. So the one that's commonly used today of hormonal methods is the pill. Now, a pill can be a combined in sense of having both estrogen or progesterone, or it could just have progesterone only. The pills are taken on a daily basis at the same time. So if you're older than 35, have a history of clots, hypertension, or cancer, then the oral contraceptive should never, ever be your primary option of birth control. So this is why it's very important to discuss with your healthcare provider in terms of your medical history before starting any forms of medication. An overview here of the pill. So the pill comes in a little tray of little tablets, either consisting of 2 hormones or a single hormone. They work very effectively to help to prevent ovulation. They are super effective. They do not interfere with sexual activity, but one of the cons are the association with headaches, mood swings, and water retention. The patch, again, also hormonal device. It's placed on the skin of the buttocks and arms and lower abdomen. It releases hormones slowly into the bloodstream. A new patch is placed every week for up to 3 weeks. And the 4th week is a patch-free week where the patient will present with a menstrual bleed. So looking at the advantages of patches, we know they create lighter periods. They're very effective against pregnancy. They don't interfere with activities like showering, bathing, as well as swimming. The cons is that it does not prevent sexually transmitted infections. The vaginal ring that we have in South Africa is called a Nuvo ring. It's also a hormonal device that releases estrogen and progesterone. It's placed in the vaginal area for 3 weeks, and then the next week is a period. It's super effective as a form of contraceptive. Now we move on to barrier devices, and the common ones on the market today is the diaphragm, bottom, the sponges, as well as the condoms. These are physical barriers which are generally used with spermicide to prevent pregnancy. They are effective when used properly and offer great protection against sexually transmitted diseases. The only disadvantage is that they can only be used once. So in terms of something permanent, we can offer female sterilization in the form of tubule ligation. This procedure involves tying, burning, or clipping of the tubes, which obstructs the pathway for fertilization to occur. It's usually a day procedure, and patients go home on the same day as the ligation is done. It's very effective, with reversal of these procedures usually carrying significant risks. So this image just highlights, this is the laparoscopic procedure that we do. We insert 2 cameras into the abdomen. We identify the fallopian tubes. We either tie it, tie and cut, or clip them. So as a result, we block the pathway for the egg to enter into the uterus. So what's our take-home message with contraception? It's effective if used properly. Discuss with your healthcare provider which option best suits you. Always notify your doctor of all health-related issues prior to starting a contraceptive. Hormonal and non-hormonal contraceptives alone cannot prevent sexually transmitted diseases, and make sure to use a barrier contraceptive as a means to all-round contraception. All right, so we're now going to move on to the third presentation, which is infertility. So infertility is defined as the inability to fall pregnant after 1 year or more of unprotected regular sexual intercourse. With increasing age, women might experience a decline to spontaneous fertility, thus investigations are carried out in 6 months rather than 1 year. So when we look at pregnancy, there must be 4 processes. 1, the body must release an egg from an ovary. 2, the sperm must fertilize the egg. 3, the fertilized egg must move from the fallopian tube into the uterus. And 4, the embryo must attach to the uterine lining. So if we're looking at this picture here, it highlights the female genitalia. So at any point from the ovary to the tube to the passage inside the uterus, if there's any abnormalities, these can result in infertility. Infertility may occur at more than one spot. Infertility is common and occurs in about 4% of married ladies between the ages of 15 and 44. In most instances, it's believed that infertility is primarily a female issue. However, in more than 35% of couples, we find male factor infertility involved. So this pie graph just shows us the maroon area, how significant male infertility is in terms of not falling pregnant. The 2 major causes for ladies resulting in infertility are ovarian complications and uterine complications. So in female infertility, what we find is that the disruption of the ovarian function plays a huge role. A woman's menstrual cycle should last an average of 28 days to 35 days. So if a woman does not have a regular period, it means ovulation hasn't occurred or the release of an egg has not happened. And these instances are commonly seen in the following conditions. Polycystic ovarian syndrome. It's characterized with multiple cysts in both ovaries. The condition can be of a genetic basis or could be associated to obesity. We find large levels of testosterone, and these actually lead to anovulation, acne, and irregular periods. So if we're looking at this image here, what we find is every month, an egg should come out of this ovary in order for fertilization to occur. But when a lady has polycystic ovaries, every spot that consists of the ovary fills up with water and multiple cysts tend to occur in both sides of the ovary. This results in hormonal imbalances and it prevents that egg from releasing. As a result, fertility does not occur. So ladies also tend to have decreased ovarian reserve with age. At puberty, we have around 300,000 eggs, and over time, this number starts to deteriorate. The use of drugs, surgery, and even congenital malformations can result in premature decrease of egg reserve. Lifestyle issues also play a huge important role in infertility. Improper or excessive weight loss or gain, poor exercise routine, and stress may result in hormonal abnormalities and result in egg loss. So if you're looking at this image displayed, we find at birth we are sitting with about 1.5 million eggs. At puberty, the number goes down to 300. And at the age of 30, we're sitting with only about 180,000 eggs. Closer to the ages of 40, you can see how significant the numbers have deteriorated to less than 45,000. Damage of the fallopian tubes is also a very common situation. It may result from a history of pelvic infections like gonorrhea, chlamydia, as well as endometriosis. In most instances, damaged fallopian tubes may only be detected with the use of specialized scans, x-rays, or laparoscopic procedures. So if we're looking at this diagram in front of us, what it just shows us is when a lady develops an infection, the infection travels up with the sperm into the uterine cavity. As it travels up, it damages the tissue and the lining that it makes contact with. It then passes into the fallopian tube and it damages the cilia and the lining inside. And as a result, this entire tube becomes damaged and it doesn't allow transport of eggs from the tube into the uterus. A way to identify a damaged tube is with a specialized test, which is called a hysterosalpingogram. Now, this test involves injections of special dyes into the uterus. It fills the uterine cavity and the tubes, and then we take x-rays. And these are the typical pictures that we see of a normal uterus and tubes. If there was an obstruction, this area will become darkened, and this could be the underlying cause for infertility. So what do we do? Couples should visit their gynecologist. A full workup will include a medical history, physical exam, pelvic ultrasounds, hormonal blood tests, and semen analysis. Invasive procedures like laparoscopy may also be done in order to identify and rectify diseases like endometriosis. So what do we do when we're trying to have a child and find that it's not working? We highlight the issues. If we're more than the age of 35, we're having irregular problems in terms of menstrual cycles, if we've tried for more than 6 months without a pregnancy, or if we have any underlying issues like endometriosis and polycystic ovaries, we've got to consult as soon as possible with our specialists. It's vital to sit down, have a discussion, and identify what the possible causes of the infertility are. Only then can decisions be made for management. So how do we go about infertility management? The first thing is lifestyle modification. This includes exercise, weight loss or gain, stress management, and supplementation with folic acid. Drugs like clomiphene citrate and Femara are often used to improve ovulation, especially in conditions like polycystic ovaries. Invasive procedures like intrauterine insemination or in vitro insemination are only considered when all else has failed. So in my practice, whenever I see patients coming through with infertility, I always lean to the non-invasive and non-medical first. So couples are encouraged to sleep properly, walk, eat, exercise, endure exercise like yoga and Pilates, and have a very positive outlook. Now, when we've tried all means of falling pregnant and have failed, only then do we turn to procedures like artificial insemination. Now, usually what we do is we inject hormonal injections into buttock areas of musculature, and that promotes the release of eggs from the ovary. And we take those eggs and we fertilize it with sperms and we form embryos that are then inserted into the uterus, and we pray for positive pregnancy outcome. So ladies, our take-home message: infertility is a common gynae problem. It has both female and male components. Couples need to seek medical help following an average of 1 year without pregnancy. Treatment is individualized according to patients' needs. Never fear to seek help, as knowledge is power. Okay, so our final presentation is going to be menopause. Gosh, where's the menopause? All right, and this is the all dreaded time for all of us ladies. So what is menopause? It's the end of the reproductive period with women. It's signaled when a woman doesn't have a period for at least 12 months.
Sorry,
Hi.
Rochelle. Yeah, I think you need to share your screen, please.
Okay. Can you see it?
Not yet.
Can you see it now?
Yep, now we can. Thank you.
Okay, good. So menopause is the end of the reproductive period. It presents when a lady doesn't have a period for about 12 months. It also describes the changes a woman goes through after stopping her period. And for each woman, the symptoms may vary. So this poor lady is experiencing a lot of stress and anxiety as reflected on her face. As you can see, there's this huge biological clock that's ticking here that's signifying the end. So what causes menopause? At puberty, a woman has roughly 300,000 eggs in her ovary. The ovary will produce hormones such as estrogen and progesterone, and they play a role in our menstrual cycle. As we age, the eggs are damaged and die, and thus around the time of menopause, there are no eggs that are released after a period. Now, if we're looking at this image in front of us, what we can see is that the estrogen levels reach a peak at about the ages of 35. And around the ages of 40, you'll see a decline of the estrogen, and this is very synonymous with the symptoms we then present with. So menopause is a regular part of aging, and it commonly starts in the late 40s and early 50s. For some women, menopause can occur before this time, and this is called premature menopause. Premature menopause can be due to surgical removal of the ovaries or conditions like endometriosis, cancer therapy, or steroid therapy. One of the commonest causes of premature menopause is premature ovarian failure, and it's seen in ladies before the ages of 40. These ovaries, they shut down, they do not produce estrogen, and as a result, a woman goes into early menopause. At least 2 to 4 years prior to menopause, we go through a stage that's called perimenopause. And during this period, there are irregular release of hormones like estrogen and progesterone. It has the following symptoms, which is associated with irregular periods. The periods may be heavy with clots. Bleeding may occur for many days. As you can see this image, this woman's looking fabulous in her 30s, smiling, skin is looking good. And that's because the estrogen levels are still within the normal levels. As the levels start to decrease in the early 40s, mid 40s, you'll find symptoms that start to appear, which is very synonymous with perimenopause. So menopausal symptoms can start in the head and affect the toes. It's a wide variety of symptoms that can present with hair loss, breast pain, loss of libido, and digestive problems. One of the key things with menopause is hot flushes, and there are sudden feelings of warmth that spread from the upper body with sweating. A lot of the hot flushes can be mild in women and severe in the others. Other symptoms commonly associated with the hot flushes are vaginal dryness, poor sleep, poor mood, and increased need to urinate. So what do you do if you feel you are presenting with symptoms? This could be an underlying menopause. Seek help as soon as possible. Visit your healthcare provider. Keep track of your menstrual pattern and discuss your symptoms. A diagnosis is usually made with a blood test to assess hormonal levels. At the same time, your provider will discuss the need for additional precautionary screening methods, which is a mammogram, pap smear, and bone mineral density tests. So as healthcare practitioners, the first thing we use in order to diagnose patients is we look at the ages. So a lady that's more than 45 presenting with irregular periods is considered to be in the perimenopause or menopausal period. We use a whole host of blood tests to identify the levels. Diagnosed with menopause, we offer management plans. Management can be geared towards medical treatment or lifestyle modification. Medical treatment might include hormonal therapy, which relieves hot flushes, vaginal dryness, mood swings, and they can come in a variety of shapes and sizes, tablets, creams, patches, or gels. Non-hormonal therapy is also considered, especially in patients where HRT is contraindicated, and these consist of natural supplements like soy and ginseng. Vitamin D and calcium is also considered for prevention of osteoporosis, and we encourage lifestyle therapy with yoga and Pilates and exercise with weight training. It's vital at this stage to avoid smoking, limiting of the alcohol, and wearing of light cotton clothing. This helps with heat regulation. In my practice, whenever we see patients coming through with symptoms of hot flushes, the key thing is to try to manage them without medication. So we would ask them to change the environment, put on a fan, use the air conditioner, breathing exercises, relaxing and working out physically. But the key thing is to avoid alcohol and smoking. So again, when we decide on management for menopause, we've got to look at an individual. We have to identify what her risk factors are. If she has risk factors associated with hypertension, clotting, or cancer, then HRT is not considered. We consider alternatives, which would definitely be non-hormonal therapy and exercise. So there are a lot of supplements that are currently on the market that we use as an alternative, and my colleague will go into detail with those. So with menopause, we find with the loss of estrogen, there are multiple complications. Estrogen is a hormone that maintains good function of the heart, the bones, the skin, and the muscle. So it's vital at the stage to become more active, as a sedentary lifestyle promotes rapid aging and deterioration of the body. Take-home message: menopause is a natural process. Confirm your diagnosis with your healthcare practitioner. Decide on the different management options and choose the one that fits you. Remember, you can manage this best by staying fit and positive. Thank you.
Thank you, Dr. Bhathraj. Yes, thank you, Dr. Bhathraj, for the most informative presentation covering such a broad range of topics, and thank you for making the information so accessible as well. Ladies, remember to write your questions to Dr. Bhathraj in the chat function. Our next speaker is Dr. Anuradha Vakri, who is joining us from London. Having her bachelor's degree in Ayurvedic medicine and surgery in Mumbai, Dr. Vakri has been running a successful practice in London, UK, for more than 13 years. She has completed a postgraduate diploma in medical legal systems and hospital administration, in addition to her diploma in Sanskrit from Mumbai University. Dr. Vakri was an associate lecturer at the Ayurvedic University of Europe, where she taught an Ayurvedic specialist module on gynecology and obstetrics on the bachelor degree program in Ayurvedic medicine. Dr. Anu has also lectured on Ayurveda in Italy and is a frequent writer on the topic in local newspapers in London. A firm believer in Ayurveda, she has a good knowledge of different herbs and enjoys making customized formulations for her patients. Dr. Anu consults with patients from across the globe and from diverse cultural backgrounds. Her presentation is titled From Menarche to Menopause. Dr. Anu, will you please share your screen? Ladies, remember to write your comments and questions in the chat for discussion after the presentation. Dr. Anu.
Hello, everyone. Can you hear me?
Yes, we can, Anu.
Yes, hello. So thank you, everyone, for giving me the opportunity and for the lovely introduction. So today we will be discussing about, just a second. Sorry, I think so it just started. Um, okay, so we will be basically talking about the journey of women from menarche to menopause through the eyes of Ayurveda. Now, what is Ayurveda? So, Ayurveda is a very traditional science. It's a 5,000-year-old science, and it is a complete health system. So, it not only tells you what to do when you're ill, but it is right from the beginning what to do so that you don't fall ill, how your diet and lifestyle should be to maintain good health, and then what to do when you fall ill. So, Ayuhu means life, and Veda means science or knowledge or wisdom. So, Ayurveda, the definition of Ayurveda is the ancient wisdom for living a healthy life. And it is a very, very traditional system. So, what does Ayurveda say? Basically, Ayurveda is a wonderful science for women's health, actually, and it describes the different stages of a woman. So right from as before 8 years old is just like a kid. So when they can do whatever you want, you can play whatever you want. But from the 8th year onwards, the changes start occurring in the body. And now today we'll be discussing in three main topics. So we'll be discussing about the menarche, how before menarche, what we should be doing during menses, how our lifestyle should be during after the delivery, post delivery, how the lifestyle should be, as well as after, before and after the menopause, how the diet and lifestyle should be. Now, while discussing this, we'll be also discussing about some white elephant. White elephant is the things which everyone knows that it's happening around you. It's happening someone in your family, but we never discuss about it. These are closed topics and no one prefers to discuss about it. So we'll be starting about our lecture. And there is always a saying that if the woman or the girl in the house, if she's happy and healthy, the whole family remains happy and healthy. So now we will be seeing how that can happen. Now, before the menarche, so the changes start occurring in the body well before the menarche. Actually, the physiological changes for a girl happens right when she's in the mother's womb. And this also whatever the diet and lifestyle is there, those things also make a huge difference in the fertility of the girl. So first, what we would advise is when a child is almost 8 to 9 years old, the secondary sexual characteristics start developing, and like very tiny hair coming up or some changes, some small changes around 9 years of age. And this is the age when, of course, you should start from beginning, but this is the age when the knowledge or teaching a girl of how to remain healthy starts. And for remaining healthy, most important is in Ayurveda, we uh, we think Ayurveda is we believe that whatever is in the nature, the similar things are in our body. So understanding the nature's pattern, the rhythms of the day and night, understanding the rhythms of the seasons is important. So Ayurveda believes in the five major elements, that is the air, fire, earth, space, and water. And these different elements combine to form different constitutions. And that makes you a unique person. So you can see around you, your children, your girl, or yourself, some are naturally thin, some are very natural, like active, running around, while some are very angry, very passionate, very dominant personalities, while some are, they like to be really slow, they're compassionate, they don't like to go too fast. So those are the unique qualities which makes you a person. And this is because the different combinations of the different elements. Now, mainly we have three major constitutions: the Vata, Pitta, and a Kapha. The Vata persons are mainly thin. They find it difficult to put on weight. They're very active, and and are very, very creative. The Pitta is mainly the fire element, and they are usually quite hungry and angry. So whenever you ask them, they're always hungry, and they're very snappy, quick to anger, but very passionate and dominant, as well as they are wonderful in leadership roles. Whereas the Kapha are very slow, steady, take time to make friendships, like to be at a calmer. They don't like anything which is more active, and they put on weight very easily as well. So this is very important for a girl who, or any lady who is approaching in different stages of life, because a girl who is naturally a Vata type of constitution of a girl, her menses are going to start later, slightly later, so around 14, 15 years of age. And of course, the periods will be scanty than usual. Whereas the Pitta person, she will be starting her periods around 12, 13 years of age, and of course her periods are going to be heavier, on slightly on the heavier side, as well as uh, more for longer duration. Whereas the Kapha girls, for them the periods might start early, but they are almost for 4 to 5 days, very soothing, no, not much pain. Whereas the Vata girls can have quite a lot of pain while having the periods. So that natural differentiation does happen. And along with that, the digestive fire also plays an important role. So how the teaching the girls how your digestion is going to be uh, is very, very important. So why am I telling this? Actually, the main thing is, I had a patient. She was a young teenage girl, and her periods were regular and everything, and suddenly her periods had stopped. And the period stopping had the mom just started wondering what has happened, so they had brought her to me. And when I spoke with the girl, she said that she and her friends were fascinated by the models. They wanted to be as thin as the models, and to be thin, the young girl was actually counting the calories what she was eating. So she was eating quite less amounts of food, and she was exercising more. So she was exercising far more than what her body needed. And because of that loss of because she was spending more energy and eating less, the body had gone into a shutdown mode. So along with rest of the complications like feeling dizzy, not having any strength, her periods had stopped. And that's why they had come to me. So first we had to think that like, I was actually shocked that what is like, how do we change this? So having a young girl to going behind the models and trying to follow their lifestyle. Or even I do get patients who are like they are models, they are dancers, and they do take laxatives or to lose weight. So losing weight has become such a big thing that people don't understand that there are natural things. So in the sense that every person is different, and your body weight, your body type, your the way you look is going to be different according to your constitution. So there is no point in comparing. Of course you should be in a healthy weight range, but there should be a moderation. You shouldn't go to excessively doing something to lose the weight. And that is important. And that's why speaking about digestion, digestive fires, and the how your digestion occurs is important. Because the Kapha girl is going to be slightly overweight, not overweight in the sense, but slightly on the heavier side in the weight range if they don't take care. Whereas the Vata person is always going to find it difficult to put on weight. So if a Kapha girl thinks that, oh, I want to be thin, I want to be very thin like a model, and try to be like that, then it is going to be difficult. Of course that would result in amenorrhea, so secondary amenorrhea, where the periods stop. So that has to be taken into consideration. Knowing how you are and how your body type is very, very important. And how of course we all know about the how do we attain that, how do we attain a good healthy weight. And this has to happen right from a young age, from around before the periods start. The girl has to know what exactly her body type is, how she's going to be naturally, and then you learn how to manage it, what to eat according to your diet and lifestyle. So of course, having a healthy, varied diet is important, having different types of like carbohydrates, proteins and everything. But most important in Ayurveda, we say that having the diet which has all the six tastes in it. So the diet which has salt, enough salt, sweet taste, astringent taste like gooseberries or lemons, or like sour taste like lemon, orange, or bitter taste like fenugreek, karela. So bitter tastes are also equally important, as well as pungent or spicy taste. So when the diet has all the six tastes in good proper proportions, that becomes a healthy diet. So instead of going for junk food, teaching a young girl of how to eat a healthy, balanced diet to keep yourself healthy is important. Now, along with that, uh, exercise and meditation are equally important. So, how do we, what happens actually? So, for a kapha type of person, kapha type of girl, there will be more lethargy. She wouldn't like to actually exercise at all. They are more like couch potatoes. They like to sit and take it easy. So, for a kapha type of girl, it's very important to have an active lifestyle, doing some sports which involve lots of muscles, like either running around or jogging, playing football, playing tennis, something which is very active. Those exercises will be quite good. Whereas for the Vata type of girl who is very, very active and they find it difficult to concentrate, for them, yoga is actually a wonderful option, because the yoga and meditation help them to feel grounded, to feel the to reduce the active where they cannot concentrate. Those things can be reduced with the meditation. Sorry, did anyone say anything? Yeah, okay. So, and for the Pitta girl who has quite a lot of anger in her, can get very snappy. For her, doing meditation along with some cooling down techniques, having less spicy food, for or meditation or thinking which to reduce the anger, is going to help throughout her life. So yes, so this is how we should be teaching the young girls before the menarche, right before the even the periods start. And when this when is incorporated in their lifestyle, it becomes a habit. So that a diet and lifestyle, good diet and lifestyle, become a habit, and that helps them to maintain their good health. Now, we will be first seeing what is a normal period, okay? How the period should be. So a normal period, the color, what Ayurveda mentions is bright red color, like you're seeing over here, of the insect or these seeds. This should be a normal color of the blood. The bleeding usually lasts from 3 to 5 days, maximum 7 days. The girl should be changing pads around 2 to 4 pads in a day. Anything less or more than that, of course, needs attention. And the quantity, what Ayurveda mentions is, of course, in allopathy, it's between like 50 to 80 ml. In Ayurveda, it works up according to 4 handfuls. So 4 handfuls of liquid is equal to how much the blood should be. So that is natural. So every person has a different handful size, and that much quantity should be of bleeding should occur for that woman during those 3 to 5 days. Uh, Menarche, delivery and menopause, all three are very, very natural processes. They shouldn't cause any problems. Of course, there is slight discomfort, but otherwise it shouldn't cause any pain, no vomiting, no diarrhea, which you usually see in girls, or neither there should be any other symptoms, because since just as you're growing up, having a menarche is a natural process. And normally the menarche occurs after any time after 11 years of age. As I said, uh, around 8 to 9 years of age, the secondary sexual characteristics like having small hair or noticing that the breasts are developing, these start happening. And usually it takes between 2 to 3 years from this start of symptoms for the periods to start. Now, so when there are associated symptoms of like vomiting, diarrhea, severe pain, they do need attention. Okay, attention as well as treatment. Now, Ayurveda mentions beautifully, it says about what should you do during your periods and what you shouldn't be doing. Now, having periods as it is a natural process, but the body does change during while periods. And you yourself, all of you must have noticed those few things happening. Some of them experience premenstrual syndrome, like symptoms like there are mood swings. For some of them, they don't feel too hungry. For some of them, there is diarrhea. For some of there is bloating. So, what should you do to prevent all those symptoms? The most important is following the nature's pattern. That is, sleeping when it's dark, waking up early in the morning, doing the exercise in the early morning before you eating your breakfast is important. And but during periods, what should be done? So naturally during period, the digestive fire, digestion reduces. You don't feel as hungry as you would on a normal day, on any other days. So the food should be mainly light meals. And what do light meals mean? Light meals mean usually eating almost three-fourths or half the amount what you're generally eating in your day-to-day life. Also, the meals based with barley or rice. The special type of rice which we call shashti rice. It means it's like a wild rice, which should be cooked in milk, and the food should be milk based during this time with barley or with rice. Also, most important is if you don't feel hungry during your periods, you don't need to stuff yourself. The body tells you if you're hungry or if you're not hungry. And hunger means that the body now is ready to have your food. So many girls, they don't feel hungry during the periods, are feeling like nausea or vomiting, and then they still try to eat. And when that happens, the rest of the complications with the menstruation do start as well. So of course, and most the other things which are quite important are many, like many have this conception that of course you shouldn't be like girls shouldn't be mixing up and not doing any work or anything like that. Ayurveda doesn't mention that. What Ayurveda says is whatever your day-to-day activities, do that during your periods, but don't do anything excessive. Don't do the excess exercises, don't do any strenuous exercises or any hard work during that time. And most important is don't do any upside down poses. Now why this is important, not doing any upside down poses like roly polies or gymnastics during your periods. I do get many patients of endometriosis, adenomyosis. And endometriosis is when tissue, the endometrial tissue, it's found outside the uterus. And ideally, there shouldn't be any reason for the endometrial tissue to go outside the uterus, isn't it? It's like it has to flow down from the vagina down directly outside. But if a young girl, you can see over here, who is doing gymnastics, or athletes, or anyone who is a dancer, who are doing quite a lot of different exercises, for them during your periods, after all, it's liquid, okay? And it's when you're doing exercises, and if these poses are done, most of my patients whom I see, they have been doing of endometriosis, they have done these exercises in their while they are on their periods, because the blood after all it just flows and it just causes the endometrial tissue to go outside the uterus, and that's when the severe pain starts with the periods. So it's important that during the periods, it's you take it easy, okay? It's not necessary to run about and do everything. It's okay to just slow down a little bit while you're on your periods, but it doesn't mean you just stop and completely lie down. You do your regular work, not an issue with that. Now also during this time, you have the best actually herbs which work are aloe vera, turmeric, cumin, shatavari, ashwagandha or ashok. These work wonderfully for different elements of periods. And you can see an ayurvedic doctor near you if you have any menstrual problems, and they will be able to help you with it. So it's not necessary that you tolerate all those pain, the period pains and everything. There are herbs and medicines naturally available for that. And during periods, you should be also avoiding the daytime naps or massage or sauna, as well as the intercourse. Now we'll be, after the menarche and normal periods, we'll be moving on to our next topic, that is the pregnancy. So pregnancy is a natural process, okay? Just as I said, as is menarche, it's a natural process. But after all, what diet and lifestyle the parents have, it is going to affect the health of a child. So Ayurveda mentions that before you think about pregnancy, first the body needs to be cleansed. So body is cleansed first with panchakarma. Panchakarma are 5 cleansing procedures, like giving like purgatives, or giving some medicines for vomiting or basti treatments. So it's basically preparing the body for pregnancy. After the body is cleansed with these natural processes, then having a healthy diet, all what the things which I had mentioned before, involving all the 6 taste and varied diet, is important for both the partners, not only for the woman, as well as the lifestyle. So having good exercise and sleeping early, waking up early in the morning are equally important when you are even thinking. So 3 months before you start for the pregnancy, you start with these things like doing the panchakarma, then having good diet and lifestyle, and that helps for preparing for the ovum and sperm to be of good quality. So when I get patients of infertility, usually these are the first things which we start. We ask them about how their diet and lifestyle is, because many times the causes lie within the diet and lifestyle. And small things, when they notice that there are many patients with infertility who there is no cause can be found even after all the tests, but there is still infertility. They are not able to get pregnant. Then these small changes in their diet and lifestyle help them significantly to and of course that helps to for them to get pregnant. From the pregnancy, of course, after during pregnancy is a big topic, so I'll need to skip it right now, but we'll be switching on to the postpartum care, which is wonderfully explained in Ayurveda. Now first and foremost important is um, we do have we do see patients of postpartum depression. So what is postpartum depression? Is continuously crying or not feeling up to yourself after the delivery. And it's like the patients sometimes they can go to different levels actually of depression. I had a patient who she actually, with her case, it made me really think that why it is so important for having the postpartum care. She was a lady in her second pregnancy, and during the first pregnancy after the delivery, she kept on crying and crying and crying, and she was overwhelmed of how to take care of the little one. And she was, of course, with not sleeping well at night, was feeding continuously. uh, she wasn't bonding with the baby either. And that all feeling of how do I do that was so overwhelming for her that she tried to throw the baby out of the window. It was just lucky that someone arrived quickly in the room and the baby was kept safe. But the lady was just like us, you and me, nothing different. She wasn't going any mental health problems or nothing. She was just a usual mother. And but why she had come to me is it was her second pregnancy, and she didn't want the same things to happen for her second pregnancy. She didn't want to undergo through all that depression of feeling sad, crying, not able to do anything, feeling of the feeling of doing something to the baby. So she loved the baby, but she didn't want to go through all those stages which she had experienced before. So Ayurveda has a wonderful postpartum care, which many Indians we do follow traditionally. And those traditions are made for a reason. So it always, see, having a baby is a very difficult thing, and raising a child, it takes huge amount of effort and help from everyone. So what should be done actually after the delivery? The mom should be emotionally and physically nurtured. Our attention is so much towards the baby that we hardly pay attention to what is happening to the mom. The mom doesn't have time either. Naturally, she just keeps on looking at the baby. That's so natural to just take care of the baby. But the mom needs equal emotional and physical nurturing. And what does Ayurveda say about that? So after a natural delivery, the diet should be mainly very light. It shouldn't be fried. Sorry, in the first few days, first 10 days especially, it should be a liquid diet, mainly which has ginger, black pepper, pipali or ajwain in it. And this helps to improve the digestion of the mom as well as give her the necessary nourishment. So whatever food you're going to make, this should have it as a liquid diet. The diet should be liquid, and that helps the promotion of the breast milk, as well as the mom is so tired after the delivery, all the getting up, feeding the baby, that massages are very important. So having oil massages after a natural birth, not after a cesarean, but after a natural birth, having massages, oil massages with warm oil, and medicated water, having bath with medicated water, as well as wrapping the abdomen is equally important. So these things are traditionally followed. Many of the women over here might be already following it, as their mom, grandma must have already told them that you have to have massages. And also, keeping yourself warm during this time is equally important. So wrapping yourself warm, keeping your eyes, like ears, head, putting jumpers or sweaters on or putting gloves on is important. Now why am I telling this basically? So when I had my delivery, I'm not a person who just follows because my mom is telling me. So I'm a child who always tries to do something different. So when I had my baby, I knew that okay, I have to keep warm and drink warm food, drink warm water, eat warm food and everything. But I said, oh, I was in India during my delivery. It was really hot, 35 degrees. And I thought, no, I'll go for cold things. And so I was drinking cold water, washing my hands and feet in cold water, not keeping myself warm. And then one day I decided, okay, let me just try and see what happens if I do what my mom is saying. And and suddenly, like when I started drinking warm water, having warm things, it felt really nice. So it does feel nice, even if you're living in a hot country, even if it's quite warm. After the delivery, keeping yourself warm, wrapping yourself warm, eating warm food, drinking warm fresh food, and drinking warm water is very important. Now, it has to be followed for almost 1.5 months. And during this time, ideally Ayurveda advises to not to eat any food which is mainly quite spicy, as well as which could increase the bloating in the lady, because whatever the mom eats, the same thing, it becomes breast milk after all. And so the same taste are going to pass on to your baby. And having dry food or cauliflower, Brussels sprouts, or chickpeas mainly could cause bloating in the baby, and hence they have the colic pain. So for that, mainly ajwain helps quite a lot. And in Ayurveda, all these things we already have. Most of you moms must have already taken it after the delivery. The fenugreek helps quite a lot in breast milk production, as well as the shatavari. Shatavari is a wonderful herb for having good amount of breast milk. The gond laddus, gond laddus are mainly made up of gond and dry fruits, and this helps for the mom to recover all the energy which she has lost, as well as it helps with the calcium content. So it helps for the bones to become strong again. The halim laddus, or the halim pudding, it helps mainly for the iron content. So it helps for the hemoglobin levels to become normal again for the ones who have lost quite a lot of blood. And hence all these are traditionally followed in our life, like they're passed on from generations to generations. You can feel free to take a photograph of this. Now, after the delivery, we'll be moving on to the next, our next phase in life, which is menopause. So, as Dr. Vatharaja has already mentioned what menopause is. We'll be seeing on actually what symptoms we have during this time and how do we take care of them naturally. So naturally, menopause is a natural process. Just as you started your periods, as natural they are, in the same way, menopause is a very natural process. Ideally, there shouldn't be any symptoms with this, no hot flushes or anything, because the periods just stop naturally. They do taper off, they do start becoming lighter, but ideally you shouldn't be having problem. If you're having problems while menopause, it means something is going wrong in your body. You have to look why this is happening, and you need to take steps to rectify them. Now, during the menopause, naturally, the body starts becoming dry. So first, we will go into when menarche happens. See, there are stages in Ayurveda. So in early stages, when the child is young, regeneration is faster than the degeneration. When you are in your middle ages, at that time regeneration and degeneration at the same level. After the menopause, the degeneration is more than the regeneration, and that's when the degeneration of the body starts. You start noticing those changes. And what changes do you notice? You notice the dryness. The vata period starts, and you notice the dryness, the joint pain, reduced muscle strength in the body. And what do you do for this to reduce and stop? You start well before. Okay, it's not when you don't start when you're on your when you're menopause. Of course, you can start anytime, it will always help, but starting well before the menopause in your early 40s or late 30s is going to help you in your next phase of life. So it is going to help you not to fall, not to have the joint pain and everything after the menopause. So how do you take care of yourself uh, perimenopausal and during menopause and after menopause? So first and foremost is, what happens is in our 30s, 20s and 30s, we are very busy in our career, family life. After 40, if you haven't been exercising, if you haven't been having good diet, make sure you're eating well, you're exercising, as well as meditation is very very important, because this is the time when the children are growing up. They don't need you much. You are achieved some stage in your career and you think what next, and that's when the anxiety or depression creep in quite often, or having a empty home, empty nest happens during this time as well, after menopause, feeling that no one needs you so much. And that's when the meditation is going to take care. The breathing techniques of yoga are equally important, as well as finding a hobby and writing a diary. Now, Ayurveda suggests that oil massages are very, very important to prevent the wrinkles, to make the skin look glowing and healthy. Oil massages are important. So you can use sesame oil, coconut oil, or for massaging your body. If you don't get time to massage yourself every day, at least massage once a week. So once a week, apply oil to all your body in downward direction, keep it on for 2 to 3 hours, and then have a shower. Coconut oil is wonderful for if you're living in a hot country like South Africa, or during winter months, sesame oil works wonderful. The same is for your face as well. You do the massages on the face. There are wonderful herbs like Shatavari, Ashwagandha, or Sariva works wonderfully for the hot flushes. And also including seeds in your diet, like sesame seeds, flax seeds. So sesame seeds have a wonderful, they have good antioxidant and help for making the bones strong, because it has good amount of calcium in it. So introducing sesame seeds in your diet is very, very important. Just a teaspoon of sesame seed, not a small teaspoon of sesame seed every morning. You can have black sesame seeds are the best, and then drinking the usual water over it. This will help your bones to be stronger, and it won't let the osteoporosis set in. Of course, your diet should be good as well. And some herbal teas. So most of them start suffering with digestive problems, like more bloating, or the digestion starts lowering as well. So having herbal teas like fennel, ajwain, or mint are wonderful during this time. Ayurveda has a complete something called as rasayam. Rasayam are rejuvenators. So these help to slow down the process of aging. And taking these herbs right from the age of 40 will help you throughout your life, throughout your older, like when you, after the menopause, when the body is growing old, the rasayan herbs help to maintain your health. So there are herbs like amla or haritaki, which are wonderful rasayan herbs. So we usually, just like you have an apple a day keeps a doctor away, in the same way we always say an amla or haritaki a day keeps the doctor away. So that helps you to maintain your health. And now the last and the most important is, what is health? So in Ayurveda, we look at the health is equilibrium in the body and mind. It's not only when you do eat well and exercise well, it's also your mental and emotional well-being is equally important. And when all of this is in good equilibrium, when your body is, when you're feeling a pleasant feeling in your mind and body, and that's when you're healthy. So ask yourself, are you healthy? If you don't feel healthy, then take steps to make yourself healthy. And yes, with that, I finish my lecture, and thank you everyone for listening to me.
Thank you very much, Dr. Bakri, for that incredibly informative presentation. Many of the herbal remedies that you have mentioned are easily accessible in South Africa. So you'd be pleased to hear that as well. And thank you for sharing how the mind, body, and consciousness work together in maintaining balance. Sunitha and Kareen have collated the questions from the chat. Sunitha, will you begin with questions for Dr. Bhathraj, followed by questions to Dr. Walker, please?
Yes, thank you so much, Varsha. Okay, firstly, I'd like to say thank you so much to the doctors. We have received quite a lot of complimentary feedback from our participants. Your presentations were very informative and very well presented. So thank you again so much. Okay, so Dr. Bhathraj, our first question was whether pap smear was necessary for non-active women, and is the vaccine recommended for older women? Okay, that's the first question.
Okay, so we don't usually do pap smears on ladies that are not sexually active. The second thing in terms of the, sorry, was it the HPV?
Yes.
So the HPV, what was it, the vaccination?
The vaccination, yes. Is it recommended for older women?
So the vaccination is primarily orientated for young girls, but what we find is that for the older group of females, there is a reduction in the symptoms or the severity of cancers. So I've actually seen that ladies that were in their 30s and 40s that received the vaccines and they were HPV positive prior to coming to visit us, we found that their HPV remained stable. So we didn't get too many of patients presenting with early cancerous lesions or cancerous lesions. So I actually recommend it to women less than the age of 45.
Okay, wonderful. Also, Vicky was asking, her daughter took the first dose of, forgive me if I'm not pronouncing this right, Cardasol in 2019. Yeah. And because of COVID, she couldn't get the second dose, and she's wondering, is it too late for her to get the second dose now, or can she still get it?
No, it's fine. You know, the sooner the better, actually. We find there's a lot of shortages with the vaccine. So as long as you take it within the year from taking your first dose, she should have cover as well. So don't get too worried about it. She should go and get it as soon as possible.
Okay, wonderful. Thank you so much. Also, there was a query about the long-term effects of copper UIDs. So for how long can women use this, and is there any long-term side effects?
So a copper device is inserted into the uterus for a period of 10 years. If now the patient has had the device for more than 10 years, the common side effects would be a very heavy discharge. A lot of patients would present with foul smell. They'd find that it's always intermittent, discoloration of the discharge from clear to yellow to green. Patients come in complaining of pains. So it's not a device, I would say, to have it in there for more than 10 years. You find a lot of infections go hand in hand because it is a foreign device. So the body tries to find ways to expel it. So if you have that device going on more than 10 years, it needs to come out.
Okay, wonderful. Thank you. We had quite a few questions on contraceptives. So Karine is going to present those to you.
Good afternoon, everybody. Once again, thank you to our wonderful presenters for presenting such wonderful and informative presentations this afternoon. Dr. Vadraj, the questions are as follows. Question number 1, please advise us on the psychological effects of contraceptives.
So when we talk psychological effects, I think a key thing going on is about mood. A lot of the hormonal therapy that we have, whether it's pills or patches or intrauterine device, all have some form of negative connotation with mood. The commonest thing that we've experienced is ladies would present with depression, a lot of anxiety, a lot of feelings of poor self-esteem, a lot of anxiety. I see this very commonly when ladies actually initiate therapy of a contraceptive, usually in that first 3 to 6 months. And usually over a period of time, the mood tends to improve. However, if we find that patients are persisting with these kinds of negative mood, I would really suggest to the patient to re-look contraceptives on a whole that contain hormonal chemicals in it. I'm a firm believer of alternative therapy. So patients need to be individualized and they have to really look at themselves as a whole. So if a patient presented with anxiety or panic issues and depression prior to even starting hormonal therapy, you find that this can be exacerbated. So hormonal therapy might not be the choice for these kinds of conditions.
Thank you for that. The next question. Is it safe to use contraceptives after taking blood thinners?
So that really will depend on what the indication of the blood thinners is. I'm just going to give you an example. So we're commonly using blood thinners for patients that are presenting with COVID. And because the key thing going forth is that COVID is associated with a high risk of blood clots. So if a patient has had, say, for example, blood thinners because of COVID, I would say to you not to use the hormonal contraceptive for at least a month. Remember, the main thing is each patient has to be individualized before we decide on hormonal therapy. Because if there's any underlying risk, especially in terms of blood clot formations or DVTs, which is the common term for that, I would say definitely do not use hormonal therapy.
Thank you. Next question. Does the use of contraceptive pills worsen conditions such as cramping and bloating?
So you get a lot of water retention that goes hand in hand. You see, typically PMS symptoms, that means associated with headache, water retention, mood changes, bloating, and bowel disturbances. And you find that ladies are on oral contraceptives tend to have worsening of their symptoms. So these are also candidates that I would say not to go towards hormonal therapy, rather use non-hormonal or even barrier contraceptives. But definitely when you see IBS patients, especially if they are on medical management for IBS, the contraceptive actually worsens their symptoms.
Thank you. And the final question. What is your view on the use of the Manera as an intervention for women older than 45 years old for hormonal imbalances and heavy bleeding? Do the risks outweigh the benefits?
So again, that patient definitely needs to be individualized. You have to have a very good medical history before you decide on which device is going to work. But in my experience with the Mirena, because we are releasing very small quantities of hormone in a day, we tend to find good results in ladies more than the ages of 40, especially during the perimenopausal period of time. So I would actually advocate the use of an intrauterine device like a Mirena and not the oral contraceptive for symptoms associated with perimenopause.
Thank you very much, Doctor. I will now hand over to Varsha.
Thank you very much. Just a quick comment from Bulelwa Mahura. It says, love, love, love Ayurveda presentation, consistent with African traditional practices too.
Thank you.
Holistic natural approaches because we are part of nature. And a very quick question to Dr. Anu. What can girls do if they experience irregular periods?
There are medications available for that. So you need to see an Ayurvedic doctor near where you live. Or if you don't have anyone Ayurvedic nearby, do have a video consultation. But irregular periods can be easily treated with Ayurveda unless and until there is any major health issue. Irregular periods, heavy menstruation, that is menorrhagia, or scanty menses, all of them can be helped with Ayurveda.
Thank you very much. Thank you, Sunita and Karine, for coordinating the question and answer session of our program. Before I hand over to our chairperson, Dr. Sarala Ramklas, with a vote of thanks, I extend our appreciation to the very skilled Sadhna Ramklas for so flawlessly coordinating the technical aspect of our event. Thank you, Sadhna. The event was executed without a glitch. I hand over to Dr. Ramklas to pass the vote of thanks.
Right, thanks, Varsha. So, wow, what an exciting session. Thank you. I'd like to express my sincere gratitude to Dr. Vathraj and Dr. Vakri, who without any hesitation accepted my request to participate on this webinar. You've given us two complementary approaches for reproductive health with valuable insights from each approach. So we're really appreciative of your time and expert advice. Thank you. Right, so advertising an event of this nature is key to its success. And for advertising, we extend our gratitude to the Arya Samaj administration, Radio Hindwani, and to all of you who shared the invitation on the social media platform. Thanks again. I'd like to acknowledge the contribution of the ladies of the Arya Samaj Women's Forum Executive, in particular, Varsha, Sunita, Karine, and Pandit Shadharani, who have worked collaboratively to ensure the success of this event. In addition, I'd like to thank Mrs. Aarti Ramlal for her gracious sponsorship and our techno-savvy assistants, Sadhna and Divya. Thank you to you, the audience, for making the time to enhance your knowledge on self-care. Please switch on your videos so we can take a picture of us all together. Be safe, be protected always, and goodbye.
Yes. And I would like to thank everyone from Arya Samaj as well for giving the opportunity. And it's wonderful actually to listen to Dr. Vathraj as well. It was really nice and wonderful. And it's a wonderful thought actually to have both of two different streams of medicine being together, and the patient, like all the ladies can take information from both the sides. So that's wonderful actually. It's a wonderful idea. Thank you.
Thank you, Anu. Thanks very much.
So much.
It's great having you both. Really lovely. All right. If we have no further comments, thank you very much for your time. Have a lovely weekend ahead. And until next time, goodbye. Thank you very much.
Thank you.
Bye.